Hey there! If you're into health and wellness, then you know it's crucial to listen to your body. Today I'm talking about something that often flies under the radar but is super important: when to see a rheumatologist. First up, persistent joint pain. If you've been dealing with joint pain for more than 6 weeks, especially if it's affecting multiple joints or getting worse over time, it's a red flag. Don't brush it off. Next, joint swelling. Noticeable swelling, warmth, redness, or tenderness in your joints? That's not just a random ache. It could be a sign of something more serious. Morning stiffness is another biggie. If your joints are stiff for more than 30 minutes every morning, it might indicate an inflammatory condition. So pay attention to how you feel when you wake up. What about a limited range of motion? Struggling to move your joints fully can make everyday activities like dressing, walking, or writing tough. It's definitely worth getting checked out. Symmetrical joint pain is a hallmark of rheumatoid arthritis. If the same joints on both sides of your body are hurting, that symmetry is not just a coincidence. Feeling constantly fatigued or weak. This isn't just about needing more sleep. It could be a sign of an underlying issue. Ever had unexplained fevers? Recurring low-grade fevers without signs of infection might suggest systemic inflammation. Definitely something to watch for. Skin rashes, especially those that appear with sun exposure, like the butterfly rash in lupus, are also warning signs. If you see this, get it checked out. Numbness or tingling in your hands and feet can indicate nerve inflammation or damage from rheumatic diseases. It's not just annoying, it's a clue. Chronic back pain, particularly if it starts before age 40 and gets worse with rest, could be a sign of ankylosing spondylitis. Don't ignore it. Unexplained chest pain or breathing problems might indicate inflammation of the lungs or heart lining. It's not just stress, it could be much more. Dry eyes or mouth. Persistent dryness can be related to conditions like Sjogren's syndrome. It's more than just irritating. Raynaud's phenomenon, where your fingers or toes turn white or blue in response to cold or stress, is often associated with rheumatic conditions. Pay attention to these color changes. Swollen glands without a clear infection? This could be another sign something's off. Positive autoimmune blood tests, like elevated levels of rheumatoid factor or ANA, are strong indicators. If you've had these tests done, follow up with a specialist. Family history matters too. If close relatives have rheumatoid arthritis, lupus, or psoriatic arthritis, you might be at higher risk. Joint deformities or changes in alignment often signal advanced arthritis. If you notice these changes, it's time to see a specialist. Frequent digestive issues like abdominal pain, bloating, or diarrhea could be linked to inflammatory bowel diseases, which may be associated with arthritis. Unexplained weight loss or loss of appetite might signal systemic inflammation. Don't ignore these signs. Eye pain or redness can occur with certain autoimmune diseases. If you experience unexplained inflammation or vision changes, consult a doctor. Bone loss or fractures might indicate osteoporosis linked to autoimmune conditions. Frequent breaks, get it checked. Muscle pain and weakness that doesn't resolve and isn't due to overuse or injury is another sign. It's not just soreness from a workout. Recurring infections, especially respiratory, could indicate an autoimmune disorder. Frequent colds, look deeper. Heat intolerance or sweating, sensitivity to heat, or other systemic changes could relate to rheumatic diseases. Not just hot flashes. Difficulty standing or walking due to pain or stiffness in your lower limbs, hips, or knees should definitely be evaluated. So there you have it. If you're experiencing any of these signs, it's time to consult a rheumatologist. Your health is worth it. Thanks for watching.